Hello, my name is Stacy Barajas, and this is my head to toe assessment video for Nursing 612. My patient, Josie Robertson, has volunteered and consented to participate in the examination, and she, prior to the examination, has emptied her bladder. We checked her height and weight, we measured her vital signs, and we checked her distance vision utilizing the Stellan chart, and the Rosenbaum chart was used to check her near vision. And I've washed my hands and we're ready to begin. First, we're going to inspect the head and the face, and we're just checking a general inspection of the skin, the hair. The hair is soft and it is evenly distributed. There is no noted alopecia, and I am just going to palpate her scalp in a rotating backward motion. It moves freely. It appears to be normal cephalic, and her external features, her eyes are symmetrical and evenly aligned on her face. Her ears as well are symmetrical on both sides and evenly distributed on her skull. Then we're going to assess her cranial nerve number 7, and we are going to go through a series of directions, okay? So first, if you can clench your teeth, smile, puff out your cheeks, wrinkle your forehead, and squeeze your eyes tightly. Okay. Next, we have already palpated the scalp. That's what we're going to do next, but her head is normocephalic, like I mentioned. Now we're going to palpate the facial bones, and we're checking for any tenderness or pain. Are you having any tenderness or pain? No swelling is noted and no notable lesions or masses noted. We will next check her temporal mandibular joint, and by that I'm going to ask her to please open your mouth and close and shift your jaw from side to side. We're assessing for any popping, clicking, or pain or discomfort. Next, we will palpate the sinuses, and first we'll do the frontal sinuses. I'm applying some minimal pressure here and here. No notable swelling. Is there any pain or tenderness?
No.
Then we're going to assess cranial nerve number 5, and we're going to use a cotton tip to assess for light and hard sensation for assessing the cranial nerve number 5 on each side of the face. So if you could please close your eyes. Okay. Soft or hard?
Stop.
Soft or hard?
Stop.
Close your eyes.
Hard. Stop. Hard.
Okay, thank you. And next we're going to assess the eyes. We are going to look at the eyelids. If you could please close your eyes. And we're just gently palpating across the eyelids, checking for any kind of any drainage, or any type of lesions or nodules on there. And then we're going to assess the sclera. It is white bilaterally, and then we're going to check the conjunctiva, and there's no redness. It's notable normal color. There's no drainage, no excessive tearing noted. And then we're going to palpate the lacrimal apparatus, and we're also checking for any drainage or any little nodules or styes in the eye area there. Next, we're going to check the eye response to light. So I'm going to check for direct and consensual to make sure that the pupils react appropriately, constrict and dilate. So I'm going to have you just look at something on the wall straight ahead and assess for direct and consensual with proper dilation and constriction of the eye, the pupil, direct and consensual. Okay, then next we're going to do the cover test of the eyes. I'm going to ask you to please cover one of your eyes for me. And then I'm gonna have you focus on the picture on the wall there. And I'm just assessing that she's able to focus in on the picture on the wall without any nystagma or any twitching or tremors. And then we'll do the other eye, please. And we're focusing again on the picture on the wall, checking for focus and no nystagma. Okay. Then we're going to check the extraocular eye movements using the 6 cardinal fields of gaze, and we're going to that assesses the cranial nerves number 3, 4, and 6. Okay, so I'm just going to ask you to please follow my pen with your eyes only. Okay. And there was no nystagma or tremors or any kind of extraocular movement noted. Next, we're going to inspect the ears, and what we're going to do is just kind of do a general inspection of the placement and the skin around the ears. So we're going to palpate the auricle around here, noting no rashes, no lumps or bumps, or any kind of drainage or sores, noting the piercings to the auricle, and it appears to be clear and no drainage or any kind of sign of infection for that area. Then we're going to assess the hearing, which is cranial nerve number 8. And I'm going to do a whisper test first. So I'm going to ask that you cover your left ear, and I'm going to say a series of numbers.
8, 1, 4.
And on the other side, 6, 8.
6, 8, 3.
And normal findings would be that the patient would be able to recall 50% correctly of the numbers and combination of numbers and letters. Okay, so then we will move on to the Weber test using the tuning fork, and we're going to place it directly on top of the head and assess for unilateral vibration and sound. You tell me when that stops.
Okay.
Okay. And that is the Weber test, and that's assessing cranial nerve number 8 again. So now we're going to do the Rhine test, and we're going to check for air versus bone conduction, and the ratio should be, the air conduction should be greater by a 2-to-1 ratio. And we're going to do the Rene test, and we're going to strike this tuning fork and place it behind the ear on the mastoid process. Just tell me when that stops, please.
Okay.
And now we're assessing for the air conduction.
Okay.
So this was a normal finding. The air conduction was greater than the bone. Next, we're going to use the otoscope to assess the tympanic membrane, and we're just going to inspect around the outer portion of the ear, and we're going to pull the auricle up, back, and looking in the ear. The tympanic membrane is pearly white, grayish in color, no signs of fluid retention, and or any type of perforation in the ear. Let's test this side. Again, the tympanic membrane is pearly gray, whitish in color, no signs of perforation. And now we're going to move along to the nose, and we're just going to kind of do a general inspection. It appears to, on general inspection of midline, no deviation. It appears normal and symmetrical on both sides. And then we're going to note the position of the septum, and make sure that it's midline. And we're just going to palpate to make sure that we don't find any type of lesions or nodules or anything like that. We're going to look inside, noting the turbinates are like pink in color to pale with no signs of perforation. Turbinates are actually non-swollen and no perforations are noted. And then we're going to, the mucosa and the nares are both pink in color and no signs of allergies. If there were a sign of allergies, it would be a green, bluish in color and inflammation. And then we're going to assess the mouth and the pharynx. First, we're going to do a general inspection of the outer lips. There's no cracks or fissures noted. It's pink in color and it appears to be moist. I'm going to have you stick out your tongue for me, please. And then we're just going to visually inspect the hard palate and the soft palate. I'm going to stick your tongue up there. And paying close attention to the floor of the mouth, assessing for any kind of lesions or any sores of any site, and there's not. Then we're going to note that there was no mouth odor, and then we're going to visualize the anterior and posterior pillars and the uvula and the tonsils to make sure if there's any kind of exudate or anything like that. So maybe stick up your tongue. Visually noted the tonsils are intact and they are toothless, and the uvula moves freely, and there's no signs of inflammation or any exudate. So then we're also going to visualize the teeth. The teeth notably are normal alignment. We would note the number of teeth, and there's notable fillings in the back, posterior, and there's no movable teeth or any loose teeth at this point. Then we would test the gag reflex, and that would be using the tongue blade, and that's assessing cranial nerves 9 and 10. So I'm going to have you stick out your tongue and say ah, and then we're going to do the gag test. So I'm going to go ahead and okay, and that was normal. And next we're going to do a general inspection of the neck. Just visually looking, the neck is symmetrical, and she's able to hold her head in an upright position without any swaying or tremors or anything of that sort. Then we're going to look at the symmetry and the smoothness of the neck and the thyroid. So I'm just checking here for the smoothness and symmetry of the neck in general. We're going to assess and palpate the thyroid gland. And then we're also noting there's no jugular vein distension at this point, but to fully assess that, the patient would have to lie down at a 45-degree angle for a proper assessment of that. So I'm just going to ask you if you could please turn your head from side to side, lean forward, lean backward, and then just a little bit of resistance, press against my hand, good, and then lean forward and backward. And it appears to be equally, muscle tone is equal and distributed on the neck. And then we're going to palpate the carotid pulses on each side, noting the rate, rhythm, and intensity, and we're doing each side by itself. That's good rhythm. And then we're going to auscultate the carotid pulses with the bell of the stethoscope on each side. And we're assessing for any bruits or any thrills, which would be an abnormal finding, and there are none, and there are no murmurs noted. Then we're going to we check the thyroid, and then I'm going to have you swallow, and the thyroid gland does move in an upright an upward position when the patient swallows, which is normal findings. So next we're going to move on into the lymph nodes. We're going to look at the pre-auricle, post-auricle, and then the occipital, the submental, the submandibular, and then we also are going to look at the supraventricular cervical chain is here, and the post cervical chain is here. We're looking for any adenopathy or any nodules or lesions or anything of that sort, and then we're also going to palpate the supraclavicular nodes. And then while we're assessing the nodes, we're going to look, I'm going to have you hold your axilla nodes, and there's no lesions or any kind of adenopathy noted in those areas. Then we are going to auscultate again the carotid arteries here using the stethoscope. And again, no thrills or views noted. And then we're going to auscultate the thyroid gland. And those are normal. And then we're going to do a general inspection of the upper extremities. So I'm going to ask that you hold your arms just straight out here. And we're just looking for the skin tone is evenly on both arms. The skin is normal pink in color. There's no rashes, no masses, there's no nevi or anything of that sort. And the hair is evenly distributed throughout on both upper extremities. Then we're going to assess for and palpate the brachial pulse, and then we're going to assess and palpate the radial pulse, and then we'll do that on both sides. We're going to look at the nail beds. They appear to be pink, no cyanosis or clubbing noted on the fingers. The capillary refill is brisk at 2 seconds, which is normal. And then we're just going to do just a general inspection of the upper extremities for the skin and everything, and make sure that there was, again, on the posterior sides, nothing noted, just a few small scarring here to the left elbow. And there's no ecchymosis or anything like that. And next we're going to move on to the back and the posterior chest. And we're going to do an inspection, general inspection of the skin and the thoracic curvature. So I'm just going to have you slide to your right and do that. So centrally glued. So we're just going to do a general inspection of the back. I'm just going to have you take a deep breath in and out. And I'm just assessing her respiratory rate, that when she inhales and exhales, it's evenly a rise and fall of the chest, to make sure that there's no accessory muscles being used or anything like that. And then we're going to just do a general inspection of the back. There appears to be no lesions. There's a few nevi that appear to be non-suspicious in formation, and there's no other abnormalities on the back. And then we're just going to check here, the costal vertebral angle, and we're going to assess for any tenderness to make sure that I'm just going to do a little palpation here and here. Any tenderness? No. That if she were to have any tenderness, that would indicate a possible like pyelonephritis or some type of kidney possible injury or disorder. And next we're going to inspect the chest, and we're going to assess for tactile firmitatis, and I'm going to place my hands here, and I'm going to ask you to repeat 99 each time that I place my hands in your chest, please.
99. 99. 99. 99.
Okay, and there is no signs of hyper residence or signs of
I think you said to say that they're like equal vibrations.
I'm sorry, there's
yeah.
no increase, right, increase in the tactile firmitus. And if there were an increase, that could indicate a consolidation, potentially like fluid accumulation or pneumonia infection. So then we're going to do the posterior lateral chest inspection, general inspection. And again, it looks normal. We're going to now assess for the diaphragmatic excursion. And what we're going to do is I'm going to have Miss Josie, I'm going to have you to take a deep breath and hold it in for me, okay, when you can. And I'm going to percuss here for the dullness area, marking here the top, and then I'm going to have you breathe normally, and then take a couple of breaths, normal breaths, and then when you're ready, I want you to please take in a deep breath and blow it out and hold it out, please. And what I'm checking for is normal expansion of the diaphragm, and any abnormalities in the difference of measurement here, greater than 5, may indicate a respiratory condition, and it is actually 3 centimeters, which is normal reporting. And then we're going to slide back around, please. For the anterior chest, we're just going to do general inspection of the chest and just make sure that everything is good with the skin tone and skin color. Here, just drop. Yeah, that's good. And then just checking the skin in general, everything looks normal. There's one little nevi noted here, scarring noted here, and other than that, it looks normal. There's no nodules or anything. And then the intraclavicular node we checked already, so there's no signs of enopathy or nodules. And then we're just watching in general the respiratory rate, no use of accessory muscles or anything of that nature. Then we're going to go ahead and we're going to check the heart sounds. And we're going to check here first the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral area. And what we're doing is we're assessing for the rate and rhythm, for any irregular rhythms, or we're checking for any murmurs or gallops, and those all are normal findings. Then we're going to, we also were noting the S1 and S2 duration. And then if you could just slide back, we're going to look at your stomach. Okay, so then we're just going to look at the general contour of the abdomen, just illuminating, looking at the skin and the contour. There's no scarring noted, there's no discoloration, and there's no lesions noted, no rashes or anything of that sort. So then we're going to go ahead and assess the bowel sounds in all 4 quadrants, listening for up to 5 minutes. Very good. And then we're just going to note like the symmetry and everything, and the movement, and it appears that if her muscle tone appears to be normal and even on both sides, and the bowel sounds are active times 4. Then we're going to auscultate the arteries, and this, first of all, we're going to utilize the bell of the stethoscope again, and we're going to check for the aorta, the renal, the iliac, and then we're going to check for the femoral as well. Okay, and then we're just going to do a light percussion and to palpate over the liver border, which is this side over here. noting the dullness over the organ. It'd be at the top of the organ here, and then we're going to start down here to find the lower portion of the liver. It appears to be freely movable. There's no hardness or tenderness noted, and also assess the kidneys too on both sides, checking for any tenderness. And then we're going to assess the spleen. And then we should not really fill the spleen unless it's enlarged and there's an issue with sometimes with mono. A patient will have an enlarged spleen with that, and we're just checking and making sure there should not be any, unless you do a very deep palpation of the spleen, you shouldn't note the spleen. And is there any tenderness or pain? Okay. And then we're going to move on to the last one.
Oh, you did that one?
And then we're going to do, which we already did a deep palpation, and we located the right costal margin of the liver and the border and the left costal margin of the spleen, and then we noted the findings. We palpated the left kidney, right kidney, no tenderness or any inflammation noted, enlargement noted. And then we're going to just check the midline aortic pulsations, checking for any kind of abnormalities here, any pulsations, or would note a potential aortic aneurysm. And then we're assessing the abdomen, the muscles contracted and were equally utilized on both sides, and no weakness noted on either side of the abdomen and the abdominal muscles. And then we're going to just do a general inspection of the lower extremities here, noting the color is pink, warm, dry. Shaving of the legs is noted on both sides. Appears though that the hair follicles are evenly distributed on both sides, noting a scar on the right knee, another scar on the left knee. And then we're going to just check for the pulses here. We're going to first, we'll just check for the dorsus pedis. They are 2+ bilaterally. And then we'll check for the posttibular on each side. They appear to be 2+ on both sides. And then attempt to palpate the popliteal pulses on both sides. And they are palpable, and they are also 2+. And then we're going to just note that there's no edema or anything, no modeling or anything of the skin as well. And then we're going to go ahead onto the musculoskeletal assessment portion, and we're going to assess for the reflexes. And I'm just going to have you just kind of dangle here, and that is normal. That is the brachial, and then we're going to do the radial. At work, or at the clinic we did, and then, okay, I'm sorry, and then we're going to do the knee, so just dangle here, and here, and then we're going to do the Achilles, okay, on both sides bilaterally, and you're looking for any signs of hyperflexion or hypoflexion, and that would indicate an abnormal finding. So we're just going to assess the muscle strength here. If you could just press against my hands and press down again and push against here. Okay. And then the last portion, we're going to just do a general inspection of the muscles again, and just turn your head both side to side for me, and forward and backward. And then if you could just meet some resistance here. and here. Okay, and then I'm just going to have you turn sideways one more time, and then we're going to do the inspection of the back. We're just going to check for the curvature of the spine, noting the cervical spine and the lumbar spine, and we're just going to have you lean forward here. We're checking for any scoliosis or kyphosis here, and we're just checking to make sure that one side of the shoulder does not is not more elevated than the other, meaning that there would be a misalignment or an abnormal symmetry in the back, and it appears to be normal. And then if you could just do one thing for me, if you could just walk here in front of me. We're just going to check your gait. Okay. And she's able to walk without any problems. And I'm just going to have you hold your arms out here. I'm going to meet resistance here. You push down, I'll push up. Okay. Now vice versa. Okay. And then noting symmetry on both sides, equal muscle tone on both sides, no signs of weakness unilaterally, and that would conclude our video. Thank you. Oh my God, I went over.